This ointment is used to treat or prevent bacterial eye infections. It contains neomycin, bacitracin, and polymyxin, which are antibiotics that stop the growth of bacteria. It also has hydrocortisone, an anti-inflammatory corticosteroid that reduces swelling. This medication only treats or prevents bacterial eye infections and will not work for other types of eye infections. It's important to use it only as directed and not to overuse it, as this can decrease its effectiveness. When using Neo-Polycin HC ointment, it's important to follow your doctor's directions. Typically, it's applied to the eyes every 3 or 4 hours. Before applying the ointment, make sure to wash your hands. Avoid touching the tip of the tube to prevent contamination. Tilt your head back, look upward, and pull down the lower eyelid to create a pouch. Squeeze a 1/2 inch strip of ointment into the pouch, then close your eye and roll the eyeball in all directions to spread the medication. Try not to blink or rub your eye. Wipe the tip of the tube with a clean tissue before recapping it. If you are using other eye medications, such as drops or ointments, make sure to apply the eye drops first and wait at least 5 minutes before applying Neo-Polycin HC ointment. If using another type of eye ointment, wait at least 10 minutes after using Neo-Polycin HC ointment. Use this medication regularly at the same times each day to get the most benefit from it. Even if your symptoms improve, continue using the medication for the full time prescribed. If there is no improvement after 2 days, inform your doctor. If you experience stinging or burning of the eyes, or temporary blurred vision after applying Neo-Polycin HC ointment, these effects should only last for a minute or 2. If they persist or worsen, it's important to inform your doctor or pharmacist right away. It's essential to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the potential risks. While many people using this medication do not experience serious side effects, prolonged or repeated use may lead to a new fungal eye infection and increase the risk of other eye problems such as glaucoma and cataracts. Be sure to use this medication only for the duration prescribed by your doctor and seek immediate medical attention if you notice any new or worsening eye symptoms, vision problems, or eye pain. Although it is rare, it's essential to be aware of the symptoms of a serious allergic reaction to this drug, including rash, itching or swelling of the face, tongue, or throat, severe dizziness, or difficulty breathing. If you experience any of these symptoms, seek medical help right away. If you notice any other effects not listed above, it's important to contact your doctor or pharmacist. In the US, you can call your doctor for medical advice about side effects, or report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can call your doctor for medical advice about side effects, or report side effects to Health Canada at 1-866-234-2345. Before using Neo-Polycin HC ointment, let your doctor or pharmacist know if you are allergic to any of its ingredients or if you have any other allergies. This product may contain inactive ingredients that can cause allergic reactions. Also, inform your doctor about your medical history, especially if you have other eye problems such as glaucoma. After applying this ointment, your vision may become temporarily blurred or unstable, so avoid driving or using machinery until your vision clears up. If you're pregnant, only use this medication if clearly needed and discuss the risks and benefits with your doctor. It's uncertain whether this drug passes into breast milk, so consult your doctor before breastfeeding. When using Neo-Polycin HC ointment, it's important to be mindful of potential drug interactions. Certain medications may alter the effectiveness or pose a higher risk for adverse reactions when used in conjunction with Neo-Polycin HC ointment. It's essential to keep a comprehensive list of all the products you use, including prescription and over-the-counter medications, as well as any herbal products, and share this information with your healthcare provider. Always seek your doctor's approval before starting, stopping, or adjusting the dosage of any medications. This will help ensure the safe and effective use of Neo-Polycin HC ointment. If this ointment is accidentally ingested, it can be harmful. If someone has taken too much and is experiencing severe symptoms like losing consciousness or difficulty breathing, it's important to seek immediate medical attention. In the US, you can call 911 for emergency help, or reach out to your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center for assistance. Remember, it's important not to share this medication with others. This medication has been specifically prescribed for your current condition, so be sure to throw away any unused medication after you have finished your treatment. Do not use it later for another infection unless your doctor specifically advises you to do so. If you are using this medication for 10 days or more, it's important to have lab and/or medical tests, such as eye exams, done while you are using this medication. Make sure to keep all of your medical and lab appointments and consult your doctor for more details. If you forget to use Neo-Polycin HC ointment, use it as soon as you remember. If it's almost time for your next dose, skip the missed dose and continue with your regular schedule. Do not use a double dose to make up for the missed one. Make sure to store Neo-Polycin HC ointment at room temperature, away from heat. It's important not to store it in the bathroom, and always keep it out of reach of children and pets. When you no longer need it or it has expired, make sure to properly discard the product. You can consult your pharmacist or local waste disposal company for the best way to do this. Remember, never flush medications down the toilet or pour them into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.